Colon cancer. What to know? Colon cancer develops when tumorous growths develop in the large intestine. It is now the third most common type of cancer in the United States. The colon or large intestine is where the body draws out water and salt from solid wastes. The waste then moves through the rectum and exits the body through the anus. Healthcare professionals recommend attending regular screenings for colon cancer from the age of 50 years. Colorectal cancer, which describes co-occurring colon cancer and rectal cancer, is also common. Rectal cancer originates in the rectum, which is the final several inches of the large intestine closest to the anus. Symptoms. Colon cancer often causes no symptoms in the earliest stages. However, symptoms may become more noticeable as it progresses. These signs and symptoms may include diarrhea or constipation, changes in stool consistency, loose, narrow stools, blood in the stool which may or may not be visible, abdominal pain, cramping, bloating or gas, continual urges to defecate despite passing stools, weakness and fatigue, unexplained weight loss, irritable bowel syndrome, iron deficiency anemia. If the cancer spreads to a new location in the body such as the liver, it can cause additional symptoms in the new area. Stages. There are different ways of assigning a stage to cancer. The stages indicate how far a cancer has spread and the size of any tumors. In colon cancer, the stages develop as follows. Stage 0, also known as carcinoma in situ. At this point, the cancer is in a very early stage. It has not grown further than the inner layer of the colon and will usually be easy to treat. Stage 1. The cancer has grown into the next layer of tissue but has not reached the lymph nodes or any other organs. Stage 2. The cancer has reached the outer layers of the colon, but it has not spread beyond the colon. Stage 3. The cancer has grown through the outer layers of the colon and it has reached 1 to 3 lymph nodes. It has not spread to distant sites, however. Stage 4. The cancer has reached outer tissues beyond the wall of the colon. As stage 4 progresses, colon cancer reaches distant parts of the body. Treatment. Treatment will depend on the type and stage of the colon cancer. A doctor will also take the age, overall health status and other characteristics of the individual into consideration when deciding on the best treatment option. There is no single treatment for any cancer. The most common options for colon cancer are surgery, chemotherapy and radiation therapy. The aim of treatment will be to remove the cancer, prevent its spread and reduce any uncomfortable symptoms. Causes. Usually cells follow an orderly process of growth, division and death. However, cancer develops when cells grow and divide uncontrollably and when they do not die at the normal point in their life cycle. Most cases of colon cancer originate from non-cancerous tumors called adenomatous polyps. This form on the inner walls of the large intestine. Cancerous cells may spread from malignant tumors to other parts of the body through the blood and lymph systems. These cancer cells can grow and invade healthy tissues nearby and throughout the body in a process called metastasis. The result is a more serious, less treatable condition. Prevention. There is no guaranteed way to prevent colon cancer. However, some preventive measures include maintaining a healthy weight, exercising regularly, consuming plenty of fruits, vegetables, and whole grains, limiting the intake of saturated fats and red meat. People should also consider limiting their alcohol consumption and quitting smoking. The American Cancer Society calculates a person's likely chance of survival using a 5-year survival rate. If a cancer has not spread outside the colon or rectum, a person is 90% as likely to survive for 5 years beyond diagnosis as a person who does not have cancer. If the cancer spreads to nearby tissues and lymph nodes, the 5-year survival rate drops to 71%. If it spreads to distant sites in the body, the rate drops to 14%. Early detection and treatment are the most effective ways to improve the outlook for a person with colon cancer.